next panelist is going to address this because it's not easy keeping good talent. It's one of the most expensive costs to any business. And so how do we do this effectively? And we're going to bring up some panelists that's going to talk about the biggest challenges, what they're facing, how they're overcoming, and hoping that this information translates really well with each one of you. So next, I'd like to invite to the stage the moderator, Masayuki Asano, Executive Officer of ACCELStars, Inc. Come on up to the stage. Help me with your panelist. Where are you? Where are you? We're streaming live. Oh, look at this grand entrance. Masayuki, that's you? Give him a round of applause. Masayuki. Whoop, is that you? You're coming this way. You want to bring your friend up too. All right, and you're bringing up the panelists. They all sit and talk about, let's figure it out so we can all, make sure our expertise is heard. Give him a round of applause. What an entrance. He's going to introduce all these panelists to you so you know who's up here, and I can help out with microphone. Time's on the clock. It gets adjusted to make sure we fit in, and I'm putting in a couple minutes for questions, okay? Great. Everyone take a seat. Good morning. Would you like to come and introduce your panelists?
Oh, yeah.
Okay, here you go. Microphone's yours.
Yes. Actually, it's been we wouldn't. It's been a couple mistaken. We are going to moderate together. Dr. Schafer is going to moderate, and I will moderate together. And we have Dirk from Switzerland, and also Naoko is also from Tokyo, Japan, and also Sanjeev, and also
it's Fatimah.
Fatimah, sorry. And so we're going to speak up for the panel. Yes.
Everyone could take a seat now. Get comfortable. Yes. All right. Sometimes things change. We love your versatility to be able to manage. Everyone has a microphone? You ready to talk? You need a microphone. Okay. I'll let you take it away any way you want to. Okay.
So, shall we start? Introduce yourself and maybe what you do for 30 to 60 seconds, maybe.
Yeah, so thank you very much, everyone, for joining us. And we will be discussing the human element. So what we decided as a panel, we are going to tell about us 30, 40 seconds, because we feel that this very first introduction really going to play a huge difference. So with further ado, I would like maybe to start. And my name is Dr. Liudmila Schafer, and I'm a board-certified medical oncologist specializing in gastrointestinal cancers. And I've been in medicine for 31 years as a clinician educator. I've learned that we really have a big mislabeling when we present a medical information. Now, I would like to ask you, raise your hand, who is in healthcare industry has a very specific terminology to your field? Yeah, so that's what exactly we all have. So it's a lot of actually mislabeling. So what we do, I'm a founder and CEO of the Dr. Connect Consultancy, where we try to teach every healthcare business defined rather than label. So that's a little introduction, and the next is Dr. Dirk.
Thanks so much. Thanks so much. I also was very glad to be here and to give some more ideas about digitization, of course. But first, I'm Dirk. I want to introduce myself. Yes, I'm a health economist, and I'm a nurse specialized for emergency care and paramedical assistant. So I've got 25 years experience on the base, of course, operational experience. So my most target is to give some ideas to give some more retention management ideas to keep the staff, nursing staff especially. I mean, they are also important for the processes, care processes, And of course, I want to give you one sentences. I think it tells us everything. Analog bad processes, after changing in digitalization processes, they are still bad. So this was my sentence, and I want to put the speak through to my colleague, Kita.
Thank you very much. Hello, everybody. I'm Naoko Kita from Japan. So my area is for women's health literacy, and I found a company 3 years ago for women's health literacy. So my concern is like of course, like workforce in healthcare field is very important, but my concern is like the women working environment is very concerning. So I'm looking forward to discuss with you today. Thank you very much.
Glad to be here. Thank you, Health 2.0. My name is Sanjeev Sahani, and I'm a healthcare leader for over 40 years. And I'm pretty much in depth with medical devices, especially I would say specialty medical devices in the Indian subcontinent and the Asian region. Very fortunate to have been a part of the transformational journey of 4 therapies, which we have built brick by brick over the years. And what do I do now? Currently, I'm a country head with a innovative German company, which is into design, development, manufacturing, and commercials of advanced tissue regeneration technologies. So in simplified world, we provide flexible solutions to complex wound restructuring. This means that we provide dermal templates, dermal replacements to patients who are acute or chronic, burn, trauma, diabetic foot ulcers, venous ulcers, pressure ulcers, cancer extractions, and scar revision surgeries. The change occurred with new technology. This is how technology changes the life of people. The ability to preserve the biological properties of a tissue is what is the need of the hour, because when you want to replace dermis, you should be able to give a dermis where the structure is not changed. So MedSkin Solutions, where I work as a country head, has a special technology called cryosafe technology, and we are able to preserve the structure of the collagen so that this has made a remarkable difference in the patient's outcome. Why India? I love India. I've been there for 40 years now in the healthcare profession, and India is an exciting and complex environment about healthcare. So I'm very pleased to talk about our experience of last 1 year with the company, and also learn from the panelists and everybody of you here about the changing world. Thank you.
Personally, I think the more specific problem we identify, the more on-point solution we can provide. And I think when it comes to healthcare, we usually think about the patient-doctor environment and that very specific setting, while healthcare itself is so much broader, it's so many layers, not only when it comes to the care, but also when it comes to organization and structure of the healthcare staff. So I think it's a very, very important issue to bring to the table, and not just kind of manage and juggle and just solve problems as professionals on a day-to-day basis, but to bring in the right expertise when it comes to this. So I think this is definitely going to be a very valuable session. And personally, as I'm also in the femtech space, founder and CEO of Truviva fertility startup. I'm very happy to see female professionals, being there louder and being concerned about these specific problems that emerge throughout these work processes. So thank you.
Yeah, Masa.
So lastly, my name is Asano. I'm in a sleep tech company, detecting sleep and arousal during sleep, and also rhythm. So basically, it's now about like 8 o'clock in the night in my country right now. I have some kind of a jet lag for now. Maybe you guys too. I mean, barely sleepy and tired right now. But just not only the rhythms, we could save people, save patients from not only sleep disorders and also depressions, maybe schizophrenia, and maybe also Parkinson, even Parkinson's disease as well. So we're trying to save the people and the patients, and also to make products for supporting the doctors, so that those are the basic social issues, so that we can attract people to save those patients and the doctors. Yeah, that's how we're doing right now.
Thank you very much. So we know that it's about 30% of employees feel undervalued. And also for the last several years, we all know that it's a huge medical personnel, healthcare professionals, not only physicians, nurses, everyone, it's a huge shortage. We all developing unbelievable, amazing AI, technology, digitalization, but when the patient comes, they really want that feel, touch. So we are trying to bring those solutions because specifically, I live in Kansas City in the United States, and we have about 40% shortage of physicians, and it's anticipated by the year 2030, it's about 100,000 only physicians, and that's not counting nurses, healthcare professionals. So we really would like to bring all together how we all can provide this human element to all digitalization that we see for the last several years. So I would like to start from our first panelist and see what is the human element, what the challenges you see from your point of view in today's world.
Oh yes, first I want to mention the strict hierarchical structures, and we need to change completely. We need to change really completely our healthcare system and leading system. That's the reason why I want to give you some more details later. But back to your questions. The most important point is to keep this stuff where they are and not put them in out-burning situations and situations they're gonna quit. Also in Switzerland, we got 13,000, we've got 8 million inhabitants at the moment, nearly, or a bit more or less. But we've got 13 vacancies. We need 13,000 more healthcare workers at the moment. In 2030, we're gonna need 20,000. So the demographic developments, of course, and the staff shortages. So this is the most important point. Not to search for new stuff, also to find the right, of course it's important, but the first step should be to keep them where they are. And that's the main focus, what I want to give you some more ideas, especially from the nursing perspective. Thanks so much.
Yeah, so they keep medical staff. So how can we provide a digital technology? Each of you sitting in the room, what can you bring to collaborate and do that part? So with that, I would like to ask what's from your standpoint, the human element and
Thank
challenges.
you. Yeah, so in Japan, maybe I expect not only in Japan, but working in hospital medical institution is really hard. It's very busy, so working from early morning to till like late night. So I'm working with like healthcare professionals, like female healthcare professionals, like raising kids or like caring parents, and then some of them like escaping from hospitals because too much work. So it's very difficult to like both private, like raising kids or caring parents, and also like working. So like the AI and digital health like covers the like more area than like the allow healthcare professional to work more flexible or more like more short time or flexible working or remote working. Then maybe more female like worker come back to the hospital medical institution. Then that's one solution, I think.
Yeah, thank you for that. Thank you for that. How about from your standpoint?
Yeah, from my standpoint, from India perspective, before I come to how we manage this challenge of attrition and acquisition and retention of high talent, let me start by saying that in India, 65% of the population is less than 35 years of age. Now, this is a very good problem to have. We have much youth there. They are running into education, high productivity, high consumption, high talent. But with that comes high ambition. And in a fast-growing market, everybody wants to grow fast. So we have a big challenge to first is to find great talent, and then to retain that great talent in the country where change is happening so fast across board. Now, what we found so far is to first understand the problem. We might start taking steps to improve retention or improve engagement, but what is the problem like? I think the problem is multifold. It's not just one. It's not just one place. Imagine the post-pandemic. The topic of the session could have been the human element of healthcare post-pandemic. Because even post-pandemic and pre-pandemic, I think behaviors have changed. Expectations have changed. People have less patience. I used to hire people all these years, and we would say about a word called career building. You have a career here. Now people talk me back and say, we want to create wealth, not build a career here. We have in us, we want to grow fast. And that's the high energy, high passion people are carrying today. So I think what we have found as of now is how can we find solutions to engage the talent we have? And is this a forced engagement? No. Is this an engagement that's in the environment? Possibly yes or no. But what do we do that automatically people feel to stay on and grow? So one thing my company did was started giving new projects to young people. And that was fantastic experience for us in Germany. In India also, we did not look at experience like in hierarchy that give the most complex project to a more senior guy. No. Anybody who has talent or passion, if somebody has both, you're very lucky. So I think one is engagement, other is learning management systems, standardized learning systems, so that continuously people learn on daily basis, not one quarterly review and one meeting in a year called annual training sessions. The current youth wants to really make a difference, and for that we have to do things which we win them. There's a saying, someone said, I must salute the person, it says that develop your employees so well that they become most wanted in the industry, and treat your employees so well that they have difficulty in leaving you. And that kind of ambition our company is trying to now aim at, how to automate, how to use digital, use other new processes to find methods of skill development, knowledge development, and also developing leaders around us. So that's my say on this so far.
Yeah, I absolutely agree, especially you mentioned about hierarchy. And we have low-level employees and high-level of employees. So how can we bridge, what can be a liaison? And I think that's what we are all here together. So how about from your standpoint, what is the human element and what is the difficult part and what's your solution?
Well, first of all, I was very happy to hear tangible solutions and something that you actually tried and worked. That's really, really good to hear. I come from a little bit different angle from the startup world. It's, it's fast, it's moving, it's very, there's a lot of space for creativity, so that is definitely a blessing to be able to operate in these circumstances. What I do see, and I think it would be a good takeaway from the startup world, is the emphasis on culture and how we start from very little, from a micro level, and you have to make it work, and then you can start moving and scaling and growing and going international. And I'm sure you probably have experiences with that with your own businesses, but from the healthcare side, even though I'm not yet a doctor, hopefully in a year or two, I'll get there. But what I do see within my training is that the young doctors, they get into a system that they have to learn, and then once you learn it, there's not much space to change it and modify it because of the hierarchical structure that we've already mentioned. And one other thing I took away from Dr. Mariam's earlier presentation about innovation is that you do need a culture, a system to channel all the potential of the existing people, and retention comes in here as well. And I think it's great work what you're doing regards to this, because definitely people, once they feel a part of something bigger than what they do, and healthcare is naturally something that is more noble, it's higher than oneself. People want to give from themselves, usually is what I experience, if there is space and if there are systems for it. So what I'm trying to say is, and what I see, as I said, just in a micro environment, is that this culture, it is investment, time and effort, but this definitely pays off, just like a good lifestyle. You won't see it tomorrow and the day after. The muscles won't start growing on your body because you went to the gym twice. But if you have the habits and the good, systems, and you're not just trying to survive, and your hospital or companies are just going for survival, then soon you'll reap the benefits of it, and you'll have a more future-centric organization.
Yeah, thank you. Education, especially right now at the crossroad, and I will tell that the reason I like this conference, because what you just brought up, and each of us from different industry and different level. Actually, we were sitting and having lunch, and I think human element just started, and I'll tell you why. So we were having lunch, and we used to go to medical conference. It's a physician conference, it's a nurse practitioner conference, it's a digital conference, it's a business conference. And here in this room, there are so many of us. And then Masa asked me, what society do you go? So I tell him, my society is American Society of Clinical Oncology. What it tells me that it has been such disconnect, and I just learned how important for all of us to unite. So I started actually pulling up, and I found out what's the society. So how about all of us, take that approach, what just Masa taught me during the lunch, and you all panelists taught me, and we all exchange, and we just go and ask each other, who is sitting next to each other, what's your society? Where do you go? What do you know? So with that, I would like to address and tell Masa, so tell us about circadian rhythm, what's your human element, since you just taught me something, And what's your solution and challenges?
Since Japan is a really aging society. I mean, in a couple years, Japan is going to be like more than 30%, maybe 40% of us age over than 65. Since that, we'll be having more of diseases, and maybe a rare disease as well. And just like we all said, we don't have enough physicians, and we need to, have a more productive facing dialogue with the patients, and also to more attractive working environment for patients and for the also patients as well. So what we are trying to do is to solve a problem to for better digitalization for doctors and also for patients as well, so that we could more better for patients and better for doctors. That's what we're trying to do, and but since that's so, we're just only facing for Japan. That's why I asked her to where we should go for next another country. Yeah.
Yeah, thank you for that. So in May 2021, in the United States, the federal law implemented all physician notes, not only physicians, all medical record automatically, lifetime, shared with the patient. So the moment it happened, when I signed the note, that note goes to the patient who is probably sitting at home on the couch, using digital technology, reading the note, seeing in the note collapsed stomach on a CT scan, gets in the car in panic, drives in the clinic, getting to the reception desk and tells me, "What is wrong with the doctor? I am dying. I have collapsed stomach." Who knows in the room what's collapsed stomach? Who thinks that it's normal? Collapsed stomach, it's normal. It is basically means just empty stomach. But when the patients see this terminology, it's shocking. So we're talking about driving on the highway. The patients basically can literally kill themselves. So by doing that and seeing all this information, so from my standpoint, that's where the Doctor Connect consultancy created, because we are trying to present in the media healthcare approachable information. So where is all terminology taught by all of you, all of us, for the community, for the patients. And it's not just during one patient encounter. I think all of us are responsible, and that is why we're sharing. So what we do at the Doctor Connect, we try to provide evidence-based information and teach the healthcare professionals, business leaders, how to present your strategically structured brand narrative. So when you appear not only on the social media, but on the reputable, different type of media, what is applicable in your country. In my situation, we went from zero being in the media to Forbes, NBC, Fox News. So we basically explain information to the public in a very understandable approach. So that's what we would like to unite all of us and help each of us how we can make patient care better. So what other solutions from your perspective, from your organization?
Yes, first I want to make a question for the audience. What do you think is the most reason to quit the job as a nurse?
Anyone would like to answer? Ma'am, please. Burnout syndrome, excellent. First row.
Thank you so much.
Did
A
everyone
very
hear that? I
important
just want to
point.
make sure everyone heard what you had to say. Come on with a microphone, okay? Because people in the back, did you hear that? Give me 2 seconds.
Oh, okay. Did you hear what I said?
Oh, yes.
Okay.
Nearly 80% what you
Okay. Yeah. So the question that you'd asked is what would make a nurse leave a job or a work that they've been doing and they're so passionate about, and it's, as you know, my colleague over here is saying, that cycle of overwork, overwhelm, not breaking the stress cycle, being in a healthcare system where it's overly managed, and these systems are being created quite purposefully to under-resource, underfund, undermine professional workforces, and people see solutions elsewhere and they're just not willing to make the vocation take precedence over their work-life balance, so they leave.
Thanks so
Thank
much.
you.
Very
I know
important.
he's standing over there, so I'm going to give him a moment at the mic because he stood online. Well done.
I'm Dr. Berneman from Switzerland, and my son is a nurse, so I get direct feedback from him. And Swiss nurses are quite well paid, so you will never hear them complain about how much they get paid. But their problem and why they quit the job is lack of dignity and lack of respect. They don't get that. If you don't respect people, if you don't give them dignity or and show them that you care what they do, and the third thing is civility. Civility of the hierarchy towards the so-called menial job-doing people. And that goes from the highly qualified nurse to the person that disinfects the restrooms. They quit because of that. They don't quit because of the money. They don't quit because their ambitions are not fulfilled. So I think one of the main things to retain people, and I used to be a strategic consultant also with an arm into recruitment of high-level people, my question was always, how do you treat your subordinates? Why do people quit their job under you? And most of the time, they didn't know. And my observation was that when you don't know why people quit, why your people quit their job, it's because of you.
Well
Thank you for
done.
that.
Give him a round of applause. I see all these
So
heads
we,
shaking.
so thank you very much. So burnout, dignity, the people want to be appreciated.
Yeah, nearly 3 or 4 weeks ago, a study told us the reason from a burnout. They made nearly 200 questionnaires, and the main reason for the burnout is lack or less. Can I tell in English? Contribution and value. Wertschätzung in German, value and recognition, that's the better word, and that's the main reason why they're going to develop this burnout, as this Mr.
What's your name, sir?
Your name, please?
Raymond.
Braniman. Thanks so much. Yes, important point, not only the money is the most motivating factor to keep this stuff. More the soft facts are questioned at the moment to keep them, and also there are some more factors. I don't know, did you hear about Burt's organization model? Anybody heard it before? It's a holistic leadership model, and it's very successful, and from the Netherlands, and also some pilot projects are introduced in Switzerland together with some universities to develop a holistic, holocratic leadership model with more participation, more transparency, more confidence, self-decision making, and self-steering without leaders, and they produce 30% less costs, and they got 40 hours more per year time per patient. They are self-making decisions, these teams, without leadership from extern. This model is a really successful model, just an example given to have some changes and paradigm change.
Thank you very much. So we are approaching end of our time, and it ended up such a vibrant discussion. Thank you so much, all panelists. Thank you to the audience. And before we conclude, I just would like to ask panelists in one word, just describe what's your human element. So we discuss about, burnout, value, appreciation. We all want to feel valuable. It's not that much about money. So just one word per panelist.
I would say respectful.
Define.
Work together, interdisciplinary, together for one goal, and that's the quality of the patient.
Maybe recognition and contribution.
Recognition, contribution, thank you.
I think it's the purpose. At every level, if the purpose is clear, you don't want to have their bosses to manage anybody's behavior. And the whole concept that training and learning is for younger and lower level people is absolutely wrong. The biggest learning is required by the highest level people. I think CEOs like us need to be learning and unlearning and relearning every time. And I would make a statement here, which I heard someone, but amazing. Someone said that in this, today the demographics is changing, socioeconomic things are changing, disease burden is changing. We talk about mental, talk about lifestyle, wellness. It was diarrhea, dysentery, typhoid, TB, cholera.
Yeah.
In the changing times, the learners will lead the world, and the learned will stay behind in the world that no longer exists. This whole universe is moving around. I think there should be continuous learning and development programs, and coaching should be taught to everyone at every level, not just the HR department. Each one of us has a responsibility of coaching each other. So I think I would say purpose. If people have purpose for what they're doing today in a company, they don't require framework or they don't require discipline. Discipline is not absence of freedom. In my view, it is a source of freedom. If there's a purpose, it becomes a source. So.
Thank you, purpose. And in one word.
My word is balance. As just going back to the human element, we are also, as caregivers, are also people, and we need all the right grounding. So, yeah, my word is balance.
Balance. Thank you. Now I would like to invite everyone, think on your one word and share with the audience. Thank you very much. Thank you all panelists. We learned a lot. And any questions, please reach out to us. And yes, sir.
Okay, we did have a couple questions here. I know, come on up here. I know you're first to jump up. I'm not going to let anyone get lazy. I told you 10,000 steps. You got to get to the mic if you want to talk. I'm not coming to you with the microphone. We got cameras all over the place to make sure that I don't get in the way of the online audience. So please, we do have a few minutes.
Yep. First, thank you very much. A very insightful discussion. Appreciate all of the elements and single word sort of comments that have come about. While we're talking about the human element, we're really talking about a very transitional healthcare mechanism. Since we are sitting here as innovators, we're talking about the human element. You talked about learning and continuous learning. But the fact remains that we are in between the old, very enforced process versus an evolving process and a bunch of disruptors. And like you said, you want talent and you want people who are excited and talented. But in the old system, you don't want those people. But in the new system, you want, those people are pushing the boundaries. So my question here is, and more than a question, it's about insights on how you balance. You brought it out very beautifully, that there's got to be a balance between a process, a driven process, versus something that's pushing at the boundaries. So, and that will really define your human element in terms of, what shall I say, motivation, purpose, and satisfaction. So I just thought I'll bring that up. Thank you.
Yeah, no, thank you very much, absolutely. And I think that balance that you discuss, I absolutely agree, because we also speak about navigator. So sometimes is that liaison navigator that brings human element. Thank you so much. Next question, please.
Hello, thank you for a wonderful discussion. It's a subject that's very dear to my heart as someone who's left clinical medicine for all the reasons that you all mentioned. My first question was related to what Mr. Pranay was saying, was the how of how you talked about disrupting hierarchy and how important that is, but we all know humans are notoriously bad at giving up power. So I wanted to ask the panelists to share insights about success stories at this destabilization of power that is so necessary for successful change. And so my second question sort of piggybacks on that, which is, what do you think of introducing physician resignation or loss of clinicians as a KPI? Like, how can you hold physician leaders accountable? So someone talked about how if you don't know why your people are quitting, it's your fault. How can you bring that into the conversation where physician leaders and executives in healthcare systems are held accountable based on the attrition of the clinical workforce that they have? Thank you.
Thank you. I just want to make sure, hold on a second, re-emphasize so one question is how to prevent resignation, correct?
So how do you break down the hierarchy, which you already mentioned is important, but do you have insights as to how to best do it? And the second question, what are the strategies that you think would be good to bring hospital and healthcare system leaders accountable for this attrition of their workforce? Because one of the things you talked about is employee engagement, for example, but the people who are driving this and who are responsible for maintaining their employees, how do we make sure that we're holding them accountable to this very important responsibility? Doctors and nurses are very expensive to train, so losing them costs a lot of money. So how can we make sure we keep them? How do you hold the right people accountable to keeping them?
Can I? From a supplier side, not from the provider side. But I think life is same everywhere. Employees join hospitals or companies, but they leave their bosses. So I think coming back to it, it's a overall cultural development of leadership around the corporate, around the hospital. Then even if something goes wrong, one can counsel, one can talk, and one can divert the energy, which is instead of quitting, find a solution here. Because if you quit, there's no other heaven there. Wherever you will go, you'll find bosses there. If all the bosses, as a community, we are developing everyone else, I think things, so improve awareness about best practices, reward best practices, and try and reward with transparency best practices.
I want to make an addition, so thanks so much. Important. I want to mention the keyword value-based healthcare management. What does it mean? Also the developments in different countries, also in Switzerland, at the moment without a national strategy, but the PROMs, I think you heard it before, so the patient-oriented outcome measurements. And this could be a base to keep them motivated, the work staff. Why? Yes, patient-centered quality measurements as a key performance indicator, the question from this madam before, Dr. Saro. Yes, it's necessary to get the current status, make an analysis, how succeed and how satisfied the customers, in this case the clients are, the patients are. the perspective from the patient-centered. That's important because also for the mainly intrinsic motivated nursing staff, not only extrinsic through monetary benefits, etc. Also important, and also the balanced word, scheduling from the night shift, etc., work-life balance. It's also important, but the most important to keep them in the company, in the hospital or pre-hospital environment, interdisciplinary, to keep them. It's important to give them feedback in a new feedback culture, and the basis, therefore, should be the KPIs, patient-centered KPIs, PROMs. I will want to repeat it, to give them a feedback how successful the taking care and the treatments are. Also, the nursing treatments are important. I want to repeat it. We made this experience in the COVID epidemic phase as well, that they are very systemic relevant. So back to the point. Give them feedbacks. Also the quality of life. We heard it from the panel discussion before. The qualities are important, but it's just one KPI. There are a lot more, and also nurses' prompts needs to be evaluated to keep them, to give them regular feedback, and to keep this stuff into this in your company.
Fantastic. I'm going to actually give you guys a round of applause. You've done a great panel. You see, you've triggered some great emotion. I was going to invite you to stay up there, but let's give them a round of applause. We're going to move on with our agenda. Thank you, everyone, for coming up here. I know that someone was up there. I would love to hear your question and open it up for everybody. They're going to take a picture. That microphone likes to roll off that table. Not happening more than once. Anyway, they'll take a picture together. And any questions around this, it's really triggering. I know you have something. Feel free to get up there. They can't answer it now, but this engages a conversation for later. And this is how you connect. Hi. Mike, Ava, you guys, can we get the microphone is on? Still not on. Give it a second.
I'm giving it a
There we go. Let's hear.
Okay, so when I was in Tel Aviv University as a researcher and a teacher's assistant, I had these two very interesting perspectives. One was where I was teaching public health promotion and understanding the patient to the MD, MPH, or MPH, MD, whatever you want. The young doctors to come. And one thing that I found was that they were already burnt out by us, the public health promoters, talking about how the patient needs their bedside manner to be top-notch, and how their feedback to us was, we're seeing patient after patient after patient after patient. We're young, they're working all the time, more than 24 hours, and we're asking them to smile and to communicate the issues and the diseases, and they're already rolling our eyes at us. That's the young generation to come. We've got the older generation who, they see the doctor or view themselves as the doctor as, what I say goes. That's the end all and be all. So there are both of them who we have to communicate that it is patient-centered. And I just had to bring this note because I think this is really crucial. We had a wonderful young doctor come and teach the young MDs and public health promoters about what she did in the beginning of COVID-19 and how patients were so alone. Everybody was masked up. Nobody saw anybody's face. And the feeling was terrifying for the patients, and the doctors were absolutely burnt out completely to the core. And what she did was she had everybody in her in where she was working in the hospital. It was Ichilov. She had all the patients in the corona ward, all the doctors put their face on, take a picture, put their face on the back, and they were smiling. So every time they were dealing with the patient, they were dealing, but they would turn around and the patient would see who they're dealing with. And that ended up spreading out all over Israel. And that's another thing. So the burnout affects the patient. And so thank you.
Okay. Right, thank you for that. Thank you. There's no doubt cause and effect, right? Every action, there's a reaction. And we're seeing this and hearing and sharing these stories are so valuable. I love that it touched a nerve on so many of us that we were really engaged with that. I want to keep you awake, keep it going. We're changing from how to sustain your staff, because next door, they got education. And they're talking about how the education system has to fix itself so that people can learn these tools in school.